Hello, everyone. My name's Brandon Siletz, and welcome to Thinking Like Einstein Alumni Day 2020. The Think Like Einstein class is a program that's designed to help first-time freshmen develop critical thinking skills that are necessary to succeed in all your science-based classes and stuff throughout your journey at Cal State Fullerton. Unfortunately, obviously, due to COVID-19 this year, we're not able to do this in person. So we're going to be doing it over Zoom and hold the presentation, here. This is our third year hosting this presentation, and we're very excited for our guest today. We have a very special guest who is originally from Southern California, born and raised, and his name is Dr. Calvin Lowe. He's been at the Children's Hospital of Los Angeles for over 20 years and currently serves as the medical director for the Children's Emergency Transport Team and facilitates sedation services in the MRI unit. Dr. Lowe has been a past executive committee member of section of transport medicine. He has published numerous articles on transport research and the role of pediatric transport team in disastrous situations. He has also authored many chapters of various pediatric subjects. Dr. Lowe has lectured on various topics such as pediatric transport medicine, flight physiology, drowning, pediatric sedation, and toxicology. His current research projects include pediatric transport medicine, pediatric sedation, pediatric pre-hospital medicine. Dr. Lowe has been seen on television and radio, as well as print interviews. He has been quoted in the LA Times and has also appeared on Larry King and the BBC radio. And without further ado, I'd like to introduce Dr. Calvin Lowe.
Hello, everybody. Thanks, Brandon. This is a pleasure to be here. It's always great to come back to Cal State Fullerton. This is the third year I've been doing the Think Like Einstein. Like Brandon was saying, it's unfortunate that the pandemic is happening. I would rather have been there in person. So I know you guys have a lot of questions for me. I guess you have a few written out, but I'd just like to give a quick slideshow. This is what I usually show when I'm in person. Unfortunately, I had a ton of videos and things like that, but because of the size, I wasn't able to send it over. But just a few things about myself here. Let's see if this is working. There we go. As you can see there, I work in the Division of Emergency and Transport Medicine at Children's Hospital Los Angeles. And the hospital is also affiliated with the University of Southern California, the Keck School of Medicine. So I'm also an associate professor there. Growing up, I always wanted to be one of two things. One was either be the quarterback of the Dallas Cowboys, which I could be right now since good old Dak has a broken ankle and the Cowboys aren't doing too well, or a rock and roll singer. That's my tribute to Eddie Van Halen. So when he passed a few days ago, I was really sad because he was a true rock guy. And I was fortunate to see Van Halen in concert a few years back. But this was the man that really put me on the path into medicine. This is Dr. Miles McCarthy. And, I graduated from Cal State Fullerton, back in 1986. So when Dr. McCarthy was still alive, he was head of the Health Professions Committee. And that's why we have the building named McCarthy Hall. Great man. Just a beautiful man too. Great mentor. And, he steered me the right course where I am today. So I really do owe a lot to Cal State Fullerton, but predominantly to Dr. McCarthy. I don't know that you know the story of him. He actually, visited multiple medical schools one summer or course of a few years, just saying, hey, there's Cal State Fullerton on the West Coast. We're a fledgling university. And I'm sure the numbers are still hold true. Brandon, you can correct me if I'm wrong, but if you get a letter from the Health Professions Committee, there's a 90% chance you're going to get in to one of the professional health schools, whether it's medicine, dentistry, nursing, pharmacy, and so forth. So that's an incredible record, and that's what drew me to Cal State Fullerton to begin with. So I graduated with a degree in chemistry with a biochemistry emphasis back in 1986. Went straight to medical school at UC Irvine. I graduated in 1990. That's a long time ago, isn't it? And then I did my internship in general pediatrics at Cedars-Sinai Medical Center. Continued with my residency. It's a total of 3 years. Your first year, you're considered an intern. Then I went right into fellowship, specializing in pediatric emergency medicine at Children's Hospital Los Angeles, starting in 1993. It was a 2-year fellowship, and I've stayed there since 1995 as an attending. So you can see there, I'm in the Division of Emergency Medicine and Transport. My full-time job is working in the emergency department at Children's Hospital Los Angeles, but I also, my administrative position is the medical director of the Allen Perwin Emergency Transport Program, and I'll talk about that a little bit later. And again, we're affiliated with the Keck School of Medicine at USC, so I am an associate professor of clinical pediatrics as a clinical educator. So we teach the medical students that come over to our hospital, and they rotate through the different areas, and so we teach them, especially when they come through the emergency department. This is Children's Hospital Los Angeles. This is our new building. We moved in there approximately 5 or 6 years ago. The hospital's been there since like early 1900s, so you can imagine different iterations of the hospital. But this is the Anderson Pavilion, state of the art, great place to work. Lots of good people there, world-renowned physicians. They do whatever they can to treat kids and take care of their families. This is a recent picture of me and the trauma team. We're just waiting for a patient that was coming in. And I sort of goof off at times, hey, let's take a selfie. We're getting ready here. So you can see us all in our garb and everything, doing all our PPE for COVID precautions. I wear like the painter's mask because I see all the patients, is to make sure, not to protect myself, but also protect the patients too, because we have to get in and out of our protective gear, wash our hands and go into the next patient. But we're all ready and start to go. You can see, I don't know if you see my cursor here, but the guy standing with his arms folded, he's the trauma surgeon. He just like so stoic, but all different personalities that we try to make it happen. Other things that we do, like I help run a sedation service where we put kids, sedate them so they can undergo MRI procedures or other procedures in the hospital. And there's also some teaching modalities where we're our teaching hospital. It's an academic center, so teaching the residents there, how to be an emergency department physician in a pediatric hospital, or lots of procedures that can be done that can be life-saving. I also do lectures across the country, as well as presenting research. There I was in Toronto at the Pediatric Academic Society meeting. So it's a great thing working in an academic setting, because you're on the cutting edge of medicine, trying to lead others and doing research. So so you can always know what's the latest in terms of pediatric medicine. Other things that I do at the hospital, I've served on the medical executive committee, board of directors, other types of administrative committees. I also serve on the committee of pediatric emergency medicine for the EMS County of Los Angeles, where I go out to different emergency departments in the county just to make sure that they are equipped and prepared to take up any type of pediatric emergency case that could come in through their doors. I also was on the executive committee of the section of transport medicine. And I also have done some course directorship where I helped lead a pediatric board review course. The pediatric emergency medicine specialty is board certified. So we have to certify it every 10 years. If you take a test once every 10 years, it's a little crazy. You have to study and review. So I helped run a course the past 3 courses. You can see there all back to 2015. This year, we're actually going to do it by Zoom. It's going to be in Dallas again, but I'll be doing my lectures from home, which is kind of nice, but I'd rather go to Dallas and watch a Cowboys game, but looks like that's not going to happen. But this is the transport division that I help run, which just means that we transport children from all over the world. Majority have come through the Los Angeles metropolitan area. We go by 3 modes of transport, which are the ground ambulance, helicopter, and also by Learjet. And you can see in this picture in the top left, you can see how cramped the ambulance can be. This is a little neonate patient, and you can see there's just so many IV pumps, the ventilators, and so forth, so it can be really cramped. But the transport team at Children's Hospital are staffed with physicians, nurses, and respiratory therapists, who I think are like the most elite team in the hospital. I know I'm biased because I am the director, but these wonderful people are strong clinically. They take care of the newborn all the way up to the 21-year-old. And we sometimes transport adults too, 78, 90-year-olds, because sometimes they wander into our emergency department by mistake, or there's a grandparent who's visiting their child in the intensive care unit. Oh, I got chest pain, boom, and they come to our emergency department and say, hey, we need to transport this person out of our emergency room to an appropriate adult facility, or cardiac or a stroke facility, so that we can get them out and optimize their care and optimize their outcome. Just quick on my family life. This is my wife, Peggy. She's, we've been married for 27 years. We do a lot of crazy things, and I'm just blessed and just fortunate to have a wonderful wife and mother to our kids. And you can see there's Elizabeth, who just graduated from Pepperdine in Austin, who is in last year at USC. You can see that we're at the Grace Sloan Memorial Hospital. For you guys are TV fans, I'll talk about that a little bit later. And things I like to do to keep myself even keeled. I think those are one of the questions, but I do train for triathlons. The hospital has one every fall. Of course, this past one was canceled due to the pandemic, but help raise funds for pediatric cancer research at the hospital. I love to travel. This is recently, we just got back from Bryce and Zion. And, my wife and I just, we're getting close to being empty nesters. So just come out and just to walk around and travel the world and do the best that we can. And some of the notable things that have come through the hospital as working at Children's Hospital because of the vicinity towards Hollywood. So Grace Sloan Memorial, you guys know that's from Grey's Anatomy. So I was fortunate enough to do some charitable events. You can see there's Miranda Bailey, and I forgot her name. It's Grace Up. I forgot her character from Grey's Anatomy. Chandra Wilson is her name for Miranda. And other things, Jamie Lee Curtis. I met other folks from at the triathlon. And I'm a big Titan supporter. So this is when Cal State Fullerton won the Big West tournament a couple of days ago. I had to run down and take my picture with Tuffy Titan. And another thing I do also is, believe it or not, I'm also an Elvis tribute artist. So one of my releases, I like to sing a few songs and perform out there. I can hear my wife rolling her eyes in the other room. And that's about it. So that just gives you a little bit of a snapshot of what I do. And let's see if we can.
That's awesome. I was just gonna say, thank you so much for sharing that. That was a really good, I think, representation of your professional life as well as your family life. And so I think we all appreciate seeing that. We did have a few questions that we wanted to just kind of ask you, just kind of as like a little panel to see your opinion.
Sure.
On your experiences and everything that you've been through thus far. So just kind of starting off, back in in the late 1980s when you graduated from Cal State Fullerton, how did your journey through Cal State Fullerton really prepare you for the rigors of medical school? How did you get that work-life balance, being a student? Because obviously the schooling is very rigorous, and it's a step up from your undergrad. So how did that really prepare you, would you say?
Yeah, it was, I'm thinking back almost 30 years now.
Yeah, I know.
Back in the day, Cal State Fullerton was a commuter school, right? I mean, yeah. I'm glad you guys have your dorms now. I think having that experience it helps you grow as a person. I lived at home. I grew up in Fullerton, so I was only 4 miles away, but I spent a lot of time at Cal State Fullerton. I know that it was a priority for me to apply to medical school and get in. I think one of the things you just have to be sure this is what you want to do. All right. Because I've had friends in med school who, they didn't know anything about the hospital until they got into their clinicals in their third year. They were book smart, they studied hard. We all do that as you become candidates for medical school. They look at, unfortunately, they still look at numbers because that's how they sort of, rate you or sort of weed you out and so forth compared to other things. But it's a matter of you have that dedication. You know, you guys have the health professions committee, you have the student health professions association. Join those groups because you need to have those people, you know, to select friends that are all in the same purpose. I hung out with 3 other guys and during my years at Cal State Fullerton, and we just pushed each other because you can try and do it alone, but it's best to have a community of friends that all in the same purpose and just go for it. Yeah, we had our time where we can balance and say, hey, let's go get a beer or something. Let's go to the football game. We had a football team back in the day. I went to every home Cal State Fullerton game, by the way, in my 4 years, in basketball and so forth. So that was also releasing to balance that because you can't be studying all the time. You can't be working all the time. My parents owned a grocery store locally in Fullerton, and I was there all the time. But when I was out, I said, it's sort of like freedom, even though I still lived at home. But it's just having that camaraderie with those friends that, okay, we got biochemistry, we got chemistry, we got biology. Let's do it. Just study, you know, make sure we can do it together. If we have a problem, ask. You know, the professors at Cal State Fullerton are also very accessible, TAs and so forth. So if you have a problem, don't be afraid to ask. I always tell my friends and students and other people that I mentor is that asking for help is not a weakness, it's a strength. So you want to improve yourself, so don't be afraid to ask.
Absolutely. And, you know, I really appreciate what you said about getting close with your peers, because I think that is a very important thing. And especially with the day and age that we're in now with Zoom, it makes it a little bit more difficult for that social interaction between peers. And so, you know, obviously, you know, that is still a very important factor. And, you know, I'm a 3rd year, so I got to experience, you know, going to classes still and, you know, meeting people and stuff. And I completely agree with you. Surrounding yourself with like-minded people who have the same, you know, goals and interests are going to drive you even further. So you know, I definitely agree that that is, you know, something that's just important in general in life, honestly.
Yeah, it's you know, you're talking about Zoom. You just imagine the new residents that came in July. They've been out of the hospital, the new graduate medical students. They hadn't seen a patient since February. So it's a little bit different, just not having that human interaction. And they're just thrown in, okay, here you go. And that's, they're actually doing pretty well, but I can see there's a little bit of a lag, but they're catching up. But yeah, you're right. Absolutely. Just find those peers, those study buddies, you know, not just in the school, but outside, just to keep yourself balanced that way.
Absolutely. And so another kind of question regarding your academic journey. So, you know, obviously, you know, everyone has their plans of how things are going to go, but things don't always go exactly how they're planned. So how many times along your journey did you hit bumps in the road, or have any, like, I don't know, classes that discouraged you, or professors who discouraged you, or, you know, how did you overcome these obstacles that kind of, you know, maybe altered you, we're considering altering your pathway?
Yeah, great question. I remember, you know, going into Cal State Fullerton, it was a neighbor friend of ours who worked in the Department of Biology, and she sort of advertised, oh, you're going to get Calvin. He's a smart kid coming out of high school, blah, 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 blah. So, you know, I go, okay, whatever. I think it was genetics. The first test I got was a C. I was like, just, you know, I was like, oh my God, what am I going to do now? So the key thing was I went to the professor, gosh, I forgot his name, but we just sat down and he said, you know what, you just have to buckle down. And he said, I was really surprised you got a C. I'm like, oh my God, all this pressure that was on me. But, you know, I just had to you know, sink down and just study harder, and actually got an A in the class. He said, and he came back to me and gave me this positive feedback. I never had a kid do that, because usually they get discouraged and drop the class. But, you know, it's just one of those things that it is what it is. It is what you put into it. I remember physiology. I didn't do all that great either, but it just pushed it along. I got a B plus. I was disappointed. Yeah, but that's good though, right? You know, in these days of age, because, you know, I think part of it too, I was self-driven. And of course, there are days that it's really hard. You get down, but then you just refocus of what you want to do. Did I want to change my major? Not really. I thought I was, you know, you always have to have a plan B or whatnot. And, you know, talking to your mentors, your counselors there, and see what's, you know, the best course for you. Again, you know, Cal State Fullerton was great in terms of the accessibility of people. You can go out and ask.
Absolutely. And yeah, and so also, kind of going along with that is, something you kind of described to me, and I like to kind of coin it as academic resilience. And I think that having resilience, pushing through, the tough parts of your academic career are, really kind of the ways that you grow as a student. I mean, it's normal for people to go through these bumps in the road and stuff, but it's how you react to those and how you kind of then prepare yourself for the next bump in the road that you face.
No,
And so it sounds like,
yeah, it's character building because you get hit
yeah,
hard because you come into high school, yeah, I'm top of the class, and boom, the next level, you're undergrad, okay. But then you go to medical school, everyone is as smart or smarter as you. And that's something you have to face up to that. It's like, I'm not used to this. And, I
yeah,
had a little bit of adjustment period for myself. It's like, okay, well, I'll just do the best that I can. And you put in as much, you get out as much as you put into it. So.
yeah. Wow, that's really interesting. I mean, yeah, that's pretty much how I was kind of expecting it to be. Like it's definitely probably a caliber switch once you, go up there. So another kind of question that I have relating to, more of your like, foundation leading up to medical school and even up into your residency and stuff. What types of like, if you remember, like studying habits, like ways that you would prepare yourself, in terms of like, even for your board examinations that you have to do every 10 years, like what are ways that you like to, because you said yourself that you also, teach. So you must know some types of studying habits and ways that you've seen other students be, successful and stuff. So could you share some of those with us?
Yeah, I think you just have to be consistent with your study and just hone in on it. You say, I need to do like a couple hours here and just break afterwards. Okay, just 2 hours at a time, let's say, and just study hard and just do it over and over again, because you can't study all day. You'll just get burnt out. So keep things fresh in your mind, review things over and over again, but just be diligent and just to a certain time where you're just going to study.
Yeah, definitely. And yeah, like I definitely think that balance in between, having fun and, having social interaction. I mean, social interaction is important, very important. I mean, it's kind of what keeps us sane, especially with, COVID going on and stuff.
Oh,
So,
absolutely.
um, I think that, definitely, like you said, like the social interaction and pairing that with, having that academic resilience is really kind of the recipe for success. It sounds like it was in your case, at least. And
Yeah, I can say,
um,
just working in my parents' grocery store and studying and just, gosh,
yeah,
you can easily get burned out. And, I appreciate why my parents raised me the way it is. I had that strong, hard work ethic, but you
yeah,
can only go so far. You just have to relax and just get a break and just rest your mind and just say, okay, there's other things to do out there that you want to explore to keep your mind active.
absolutely. Yeah. And so, kind of going off of that, so when did you really like realize that like pediatrics was like what you wanted to do? Like when did you realize that, okay, like this is the pathway that I want to set for my career and the specialty that I want to go into? Was there any defining moment, any defining case that happened or something that really swayed you to that direction in your residency?
Yeah, I think it actually happened in medical school when, after your 2 years of just didactic teaching, you get thrown into the clinical realm. So your third year, you do your clerkship. So I did surgery, internal medicine, psychiatry, OB/GYN, and pediatrics. I did pediatrics last. I don't know why, it's just the way it was, but after each clerkship, it's like, oh man, I'm gonna be an internal medicine doctor. I'm gonna be a psychiatrist. I just loved every one of them. I thought I was gonna be an OB/GYN. I delivered 25 babies during my third year of medical school. I was like, this is great, And I think, wow, but you're up all night all the time, though, So when pediatrics came around, it was really close. Everybody was laid back. One of the things, though, also, I also did an emergency medicine rotation elective during my fourth year. What really popped in my mind was that how uncomfortable these emergency medicine doctors were dealing with kids. Because I don't like dealing with kids. They don't talk, they deal with the parents. And I'm thinking, well, why is that? I mean, the kids are cool. I know a lot of people, so I like to go into pediatrics because I like kids. But the thing is, do you like sick kids? That's the thing, right? So I just see this uncomfortableness between these emergency room doctors. I said, wow, if I can combine the two, at least when I have my own kids and something at least it looks like I know what I'm doing. But that was that. I said I can combine the two. When I went to pediatrics, I went through all the the residency for 3 years, and I think, wow, yes, do I want to become a general pediatrician and just open up a shop or an office and just give shots and antibiotics? No, I want to do something that I want to get my hands into, procedures, life-saving things that could make a difference. And I found that was a perfect marriage of putting pediatrics and emergency medicine together.
Yeah, wow, that's really interesting, and it sounds like it's something that you're very passionate about as well. Um, as so, when you were doing your rotations and stuff throughout, you said that pretty much all the other ones also interest you as well. Were there any rotations that you went through where you're like, okay, this is not for me. Like, I do not want to be, gastroenterologist, or I don't want to, whatever it might be. Was there
Yeah,
any ones where you're like,
Well, I think what turned me off about internal medicine, I had to do rotation through the Veterans Administration. So you deal with all that's doing an awesome thing, but and those guys, they get really sick. And that's also sometimes the attendings there, the attending physicians. Maybe I got a little turned off. Some were like, really stickler for things. Like, oh, that's not the right age. And sort of, it was unfortunate. I think it turned me off in that respect. So it depends on, like you have a coach, right? You can have a good coach or a bad coach. You can determine the rest of your career. So I think, and I took that in terms of my career and in teaching my residents and the medical students. Okay, I just want to make this fun. They can understand, make it a great learning environment. So maybe I can inspire somebody to become a pediatric emergency medicine doctor, or use my ways or my teaching methods that they can inspire others to do what they want to do.
Yeah, and I definitely kind of probably I feel like I kind of see that probably as a pediatric, being in pediatrics just in general, you have to have really good bedside manner and really good, interpersonal skills, because, you're talking to, little humans. These people are not going to understand the terminology that you say. They're confused and stuff. So, I mean, that really takes, I think, an additional skill and additional type of person really to be able to do pediatrics. Also, the communication between parents as well. I bet it gets pretty complicated.
Yeah, that's half the battle right there, because you have to deal with the parents, because you're dealing with two people basically. Because I'm a parent too. I can understand it to some extent, and they're like, oh, they Googling things before coming in, and Dr. Google, don't use Dr. Google, okay? And that just makes things work, because I'll have my colleagues or other physicians come in with their kids, and it makes it a little worse sometimes. So they have some medical knowledge. It's really tough. Like, oh no, they always think about the worst thing. Yeah, we do that in the emergency department just to make sure we're not dealing with the worst thing. We rule out the worst thing, but one mindset going in, that makes it a little bit difficult. And a lot of different cultural attitudes that come in as well. Some of the different ethnicities that come in. You have to be sensitive to that. And it's very difficult at times. But we treat every patient and their families the same way. And it's just you get all kinds, and it goes up and down. But that's makes it exciting, so to speak. It's a challenge. And I always say, oh, I've seen everything now, but everything that comes in, like, oh my goodness, let's not just medically, but socially, emotionally, spiritually, things like that. So you'll see
it's such a encompassing career, really. There's so many different aspects of your life that get changed and are also brought out through that career, I feel like.
Yeah, and you don't know what's going to come in those doors every time. That's the exciting part. So I don't know what's going to come in. The other day I said, well, I haven't had a bad trauma in a while. I was like, boom, like, and stop. Like, things,
Yeah,
but, just good to keep us on our toes.
Yeah, exactly. Kind of moving on to maybe the types of extracurriculars you were involved in as an undergrad. Were there any? I know you mentioned that you joined a couple like pre-health clubs and you got involved with like a few friends and stuff. But were there like any like programs that you joined specifically that you're like to look good for, medical school? Like, did you join research as an undergrad? Maybe like try to work like in, type of like lab setting, or what type of extracurriculars did you do to better yourself as an applicant?
Yeah, I did research in the biochemistry department. That was part of the degree part. But one of the things that Dr. McCarthy recommended is, if you really want to go into medicine, you should do something in medicine. And one of the things was I did the emergency medical technician course at Mount San Antonio. Basically, the people who go to school there are the ones who work with the ambulance companies. So part of that was also an internship in one of the local emergency departments. So I forget it was like a 6-week course, but part of that was also interning I did it at the Pomona Valley emergency department. So I worked as an orderly or EMT student. So I got to help clean wounds and, transport patients to different parts of the hospital. So it gave me an introduction, as well as getting to ride on the ambulances, the paramedic teams and so forth, just to see what it was like. So I think that's key for anybody who wants to go into medicine in particular, because you got to know if that's something you want to do. So that just really solidified me that I wanted to do it. And also it was helpful because, hey, he did an EMT course. You can draw from your experiences from that.
Yeah. And, and one of the things you brought up is, I hear about people where, they go, oh, I want to be a doctor. I want to do this so bad. It's something I've always wanted done. And then they get put in the situation where like, they're actually like with a patient and they're like, like, I don't want to do this. I don't like the emergency room, whatever it might be. So I think, surrounding yourself around medicine and realizing whether it's for you or not for you is, another important thing. So it's more than just the academics. I mean, as you stated, it's really like, is that the lifestyle that you want to live?
Yeah. Back in the day, pre-COVID, I would invite, undergrads like you and say, hey, why don't you come shadow me? I think it's a great way. Just look, at least it's different in the emergency department at Children's Hospital. You just follow me, shadow me, and say, hey, this is what it's like. This is what we see in a typical day. It might be a good day. You see lots of trauma, broken bones, suturing. It could be a boring day. You see a bunch of colds and fevers. So unfortunately, because of the pandemic, I can't extend that offer at this time. But again, if you are able to just somebody, a family member who is a physician or a dentist that they can can follow along, I think that's invaluable experience and knowledge that you can gain from that.
Yeah, absolutely. So, yeah, like definitely, like I think getting exposure on medicine is important. As well, like just the like you said, like really knowing if it is your cup of tea, basically.
Right.
Kind of moving through that, you mentioned earlier, so all in all you did 4 years undergrad, you did your 4 years of medical school, and then you did your 3 years of residency and 2 years of fellowship.
Right.
Okay, so grand total of 8 to what would it be then?
13 years, I think.
13. Okay, wow. So
another K-12 after high school.
Yeah, exactly. And so, a lot of people, consider taking gap years in between medical school to kind of prepare for medical school. As a, someone who didn't take a gap year, what's your opinion on, gap years, would you say?
If your life, I think there's certain things that come in your life and you have to take a gap year, that's fine. For me,
yeah,
I just bowled through it because I thought, honestly, I think it's a bit depends on your personality too. If you need to take a gap year, cool down, do some work, do some research if you want to improve your application, great. For me, I thought if I took a gap year, I'd probably probably just just slow down, I ramp this up again. So I think for me personally, I think it was best for me just to go right through it.
Yeah.
So just to keep the challenges going, but a gap year I think is great too. If you need to have it, if let's say, I don't know, your scores weren't good on your MCATs, you just want to study more, yeah, that's fine. Whatever it takes that you think you need to recharge your batteries, to see a different outlook, to improve your application. I have nothing against that. Whatever works for that individual.
Yeah, definitely. But I think as it's my third year personally, like as my undergrad, and so I'm starting to approach my fourth year, and then coming up, and when am I going to take the MCAT, stuff like that. And so a lot of people who are kind of at my peer level at that year, we're really starting to go, okay, are we starting to study for the MCAT, or are we going to take the MCAT later on and try to improve our application and stuff, and maybe not focus on that our senior year and wait until afterwards. And so I think that's something that's on a lot of people's minds, because there's sometimes there's a negative stigma to it, and then sometimes there's people who praise it and say, oh, like it's such a good way to improve your your repertoire, I guess. It makes you look better on paper. And so, there's just a lot of different, conflicting things that people have about that. And so it's definitely something that's on a lot of people's minds, I think, especially kind of like the situation and year that I'm in right now.
Yeah.
At least I've heard a lot of people talking about it, and people are going, man, I don't know what to do. And so it's just, it's interesting because, I think you're right. It does come down to the type of person. Are you the type of person that can step away from something and then come back to it and buckle down? Or is that going to discourage you? And then are you going to maybe not want to end up pursuing it? So it's like a catch-22 almost.
Yeah, for me, if I would have found a job, something I really liked, something different, I said, I might have delayed it a little bit more. I'm glad in retrospect I didn't do the gap year because where I am now. But again, I think it's an individual decision, and whatever decision you do, just stick to it. You can't say it shouldn't be any remorse.
Yeah,
you did it because you thought it was the right decision. So.
Yeah, absolutely. So, kind of now going into your beginning years of actually being able to like see patients and do stuff. So like, I guess the last 2 years of your medical school and then kind of going into your residency, were there any, experiences that, you had during those like beginning years that you, maybe like some difficulties or maybe some like things that you were uncomfortable with? And how did you like get over like that? How did you get to where you were comfortable in the hospital and comfortable doing things? Because I think that's another thing for maybe some starting out medical students where they go, okay, like I know, on paper how to intubate someone or whatever it might be, but actually doing it and doing it confidently is a different thing.
Yeah, that's a good question too. So I think I use my experience, believe it or not, working in my parents' store because it's more of a customer service. You have to use good communication skills to deal with patients. I do remember my very first case in my rotation at the Veterans Administration where I was with the intern and we had to put a nasal gastric tube in this guy's nose. And this particular older gentleman patient was probably, hospice, DNR, that type of thing. And when we put the NG tube on, he just died. And so what probably happened, he probably bailed down, heart stopped, and his two sons were there. And my intern said, "Oh, I'm sorry, your father has just died." And I was like, "Whoa, this is my very first patient in medical school. Just died literally in 15 minutes." And I went home, I remember the weekend, and I was just bawling my eyes out in front of my mom. I said, "I can't believe this guy just died in front of me." But
yeah,
that was just like a stepping stone in medicine, especially in emergency medicine. I know that we can't save every patient. And, that's the thing. We do our best, and not knowing, I guess, at the time where all the circumstances with this gentleman, I just knew that, okay, right, I'm going to do a procedure. And then, next thing I know, he expired. So other cases like that, other things now back in the day where we had like HIV was coming out big too. And we see a lot of like the early findings of that, and having to draw blood as a resident or a medical student, you're the one that had to draw the blood work, not the nurses, because it's a teaching hospital and taking precaution and just like, oh my God, I just hope I don't stick myself and, do the proper procedures and so forth. So a lot of things like that, you overcome because you get better. And not only in your procedures, but your communication skills, you gain knowledge, expand on your knowledge base.
Yeah, absolutely.
And you grow from it.
Life experiences. Definitely. I mean, yes, I'm sure. I mean, that's actually really, really interesting, that story about the NG tube, because you would never expect, that's something you would never expect to happen. Someone to pass away just from, getting an NG tube placed into them. And so that's, I guess, do you sometimes just see things that are just like, I don't know, things you do not expect at all happen, like being in emergency medicine?
Yeah, all the time. I mean, I just going along those lines, I remember early in my career, we've had these Asian girls that came in like back-to-back weeks, and they were trauma kids, and one got run over by her uncle in the blind spot of their church parking lot. and had a floating cranium. I mean, like the kid was already dead on arrival. I'm like, oh my God, this kid looks like my daughter. These things really like, oh boy, you know. So I drove home that night. My daughter's like 4 years old. She's sleeping there. I just sat in her bed and just looking at her. I said, oh boy, just thankful. Like, you know, these things can happen. In another case, there's another little Asian girl came, same thing. And like, whoa, you know, and a lot of things are beyond your control and just what it is, but it still can affect you as a human being. So it just things, you know, I don't want to say, oh yeah, I develop a hard, cold shell about this. No, it affects everybody, because I don't care if you're like the tough surgeon, trauma surgeon, let's keep going, but it's something wrong if it doesn't affect you.
Yeah. And, you know, I think it definitely makes you probably have a lot bigger appreciation than most people for, you know, realizing how fragile life is in mortality, and actually realizing that, like, you know, not every day is promised for everybody, you know? And so I think that's something that you definitely probably learn in your line of field very quickly.
Yeah, you know, I've had kids come in and they're coding, you know, the paramedics are, you know, pounding on the chest, the nurses are going in there. I can tell within the first 5 to 10 minutes that this is not going to go well. And that's one of the toughest things. And people are, you know, so how long we're going to go? Because usually when you're in a code situation, the chances of a patient coming back after 20 minutes is pretty almost nil. And I know within the first 5 to 10 minutes that this isn't going well. And you know, just prepare yourself what's going to happen afterwards.
I'm sure that's probably a very tough part of the profession. Having those unexpected losses or times where you think someone's going to pull through and then they end up not.
Yeah, you know, it's another thing too, because it's not so much the patients dying. That's not the hardest part of my job. The hardest part of my job is telling the parents that the child has died. Yeah, I would say, okay, the code's over. I'll get my resident or my medical assistant. Okay, come watch me do my hardest part of my job, because it just, you know, it's just such heartbreaking news. And, you know, it's just one of those things that you just have to deal with. And nowadays we have like debriefing episodes or sessions afterwards. Okay, how does everybody feel? We did everything right, but how does everybody feel emotionally? Okay, just talk about it and just help to, you know, just diffuse the situation, which I think is very helpful.
Yeah, I think that's important, definitely, to realize, you know, not just have such an autonomous idea behind, you know, oh, someone's gone, okay, next patient, you know, really like having that, you know, compassion and, you know, that realization of mortality. Because you know, I think especially, you know, in college and stuff, you know, we're young, we don't really think about our mortality, but, you know, it's so simple. I mean, it's really crazy how quickly you know, something can happen to somebody and you don't even realize it. And yeah, obviously, you know, that from firsthand experience. So, I mean, that's, you know, a very interesting aspect of your career that I think, you know, besides, you know, firefighters and other first responders, the average person doesn't really, you know, get exposed to that type of, you know, scenarios.
Yeah, I remember when it was your age, like, oh, I'm invincible, you know, right? But then you go through these life changing experiences. Fortunately, they're few and far between, but I've seen enough. We're like, okay, you know, you think about your own mortality too. What's going on here?
Yeah, absolutely. Kind of switching pace a little bit. If we were to talk, so moving from that, if we're looking at, like, you know, let's say a student who's very passionate about medicine, and, you know, let's say they've wanted to go into medicine for a while and stuff. What type of advice would you give them? Because when I told my, like, physician that I wanted to go into medicine, he told me, no, you don't. He said, no, you don't. So that was the advice that I got, but maybe you could offer up a little bit more.
That's fun. I've heard that story many more times than what my story would be. I think it's great that you want to go into the profession, because I did it because now I think I can make a difference in some of these kids' lives, you know, whether diagnosing with leukemia, okay, we got it early enough, let's send you off to the oncology team, they can take care of you, because 95% of kids with leukemia are you know, do well. They're cured. And or like a trauma patient, I have to deal with the airway, I have to intubate them, support their status. And I see some kids come in who are ghastly sick and they walk out, and, you know, like a week later. It's amazing. So, this is something that is what you want to do. The road is hard, and the road is expensive as well, because you can see, Cal State Fullerton, then medical school. Not only that, you might have to go out of state and do your residency. Residency pays a little bit better now. Then you're out, on your own after residency. You become an attending or do a fellowship, and then your loans start, kicking in. So it's something that if you really are passionate and want to do it, again, get the experience, make sure you want to do it. But you have to have the heart that you want to help these people in need, people who are asking for help, people who are weak. So you're there for them.
Yeah, absolutely.
And I totally encourage. I've heard those other stories, like you're saying, like, oh, don't go in. Why do people say that? Yeah, I guess maybe that person, that doctor isn't happy. You're not going in for the money. Maybe you thought, oh, whatever. But I think you have to have an appreciation of what you do.
Yeah, definitely. Yeah, like in my experience, they definitely kind of were just saying, there's other careers that you can do that are, still, you make a difference and stuff, but like, medicine is so rigorous and stuff. And so they've almost been kind of like trying to discourage people. But I think that, the real thing is you have to look intrinsically and go, okay, is this, something that is me? Like, is this me? Is this something that I can see myself doing in the future? And, I think it's more of that, definitely. And, everything, I'm a firm believer that everything in your life comes down to drive. And, if you simply have the drive for it, you can do it. And so, that's definitely kind of one of the key things that I've always thought.
Yeah, I think you're looking at my colleagues and some of the best doctors I know, some of my good friends who are doctors. That is the key thing. It's the drive to do it, to continue to do it, and to do it well, to improve yourself. Don't think you know it all and that's it. It's just learning. I learn from my residents, my medical students every day. Oh, that's something new. I never heard that. Teach me about that. To be a two-way street. Don't think, oh yeah, everything just stops with me. Yeah, it does. Officially, it does. But I think, just learning, just being open-minded to all the different things. Oh, this is what we do upstairs, Calvin. I said, okay, I'll look into that. That's fine. Just keep an open mind.
Yeah. And so ever since you first got into the field of pediatric transport medicine, has it evolved over time? As, obviously different medical practices have happened and stuff. And I'm not sure, are you a DO or an MD? And how does that, play into your role as a, emergency transport physician?
Yeah, I'm a MD. And in terms of pediatric transport medicine, I wish I could show the videos of what we do on transport. Because again, what we do, we transport kids from all over the world, not only to Children's Hospital in Los Angeles, but to other hospitals so that they get the specialized care. So to optimize their chances, because sometimes we're the only hope that they have, the transport team. So let's say you have a baby out in Las Vegas who has this really difficult cardiac lesion and needs surgery right away. They call us, we take a helicopter out there, hour and a half, we're in Vegas, and fly back to Children's Hospital Los Angeles. So things that has changed over the years is, I think it's just the mode of transport. Before, we used to drive everywhere, like here to Fontana, to Bakersfield. You can imagine LA or California highways. Then we had our helicopters coming probably about 15 years ago. We have 2 helicopters now. So it's point to point. We can take off from our helipad, go to Bakersfield. It takes like 20 minutes and come back. Or let's say if, Lakers were playing, at Staples this year, and it's Friday night, we have to go to Redondo or Torrance, going down the 110. It'll take an hour and a half, 10 minutes by helicopter. So there's things that we can get these kids in and out faster. And we can do a lot of different things in the helicopter. We can do ventilations. We do administer. We were one of the first helicopter teams to administer nitrous oxide, which is a pulmonary vasodilator. Helps children when they're born. Sometimes their blood pressures in their lungs are so high they can't oxygenate. So we administer the nitric oxide, helps them vasodilate it. It's the bridge that they can come back. We can work on them. So we've also gone by Learjet to different distant lands. We've gone to like Thailand, Germany, Mexico. So people come here because they want to get the best care, and I think that's the greatest, one of the best services that we can provide.
Yeah, that's amazing. So you actually, I'm sure in probably some situations, you actually have to start doing life-saving procedures and certain things during transport. So that's probably such a different thing than like
one of my classic stories that I have was I was transporting a kid from Hawaii. He actually was going to Stanford for a little neonate for specialized care. And one of the rules is if something happens on the FAA says if you're flying over the Pacific, something happens for the halfway line, you go back to the islands, versus if it happens passway, you go right into the mainland. So we're flying along. The kid had like epinephrine, norepinephrine, all these vasopressor drips. And we knew this kid was going to crash sometime, just code.
Yeah.
But we're just like crossing our face. Oh, maybe we'll make it the 4.5 hours. And we just crossed the halfway point, and all of a sudden everything went to zeros. No heart rate, no blood pressure. Actually, we just ripped off everything off the isolate. I'm doing chest compressions, giving medications. We coded the kid for 2.5 hours. Kid survived still. But, we gave like 40 rounds of medications, because what are you going to do for the last 2.5 hours? I could have pronounced him dead, but okay, with nothing to do with it. We'll just keep it going. But it's just one of those sensational stories that the kid actually survived. Yeah. And he's doing okay as far as I know. This is a few years back, but it was, incredible journey.
That is incredible. Wow. So, as kind of, moving on more into like your, how you balance your family life and stuff, actually being, in the position that you are now, how do you, make sure that you give yourself enough time, your self-care? You said that you do triathlons and you keep physically fit and stuff. And so how do you, make sure that you are optimizing the time that you spend with your family? And, you actually get to have that, family interaction with the busy lifestyle that I'm sure you have.
Yeah, that's a great question, because my wife says we have to do everything because of your schedule. And I used to be like, I used to take that harshly, but that is my schedule because I work mornings, afternoons, evenings, and overnights. So my schedule is regularly irregular, to put it. So we put the schedule down. We work around my schedule.
Yeah.
Okay, we're going to go on a date night, or we're going to have an hour to sit down. Like my wife and I, we do devotions, Bible study, or I'm going to exercise at this time. So the key thing is not to make your work your life. I fell victim to that early on in my career. I thought, that's just what I have to do. I have to provide for my family. I have to work, blah, blah, blah. But I realized I want to miss these things that my kids are growing up. I try to make all my sons' baseball games, or my daughter's, piano recitals, or whatever she's doing. And now I appreciate the time that I was actually able to spend with them. So you got to make time, you make your family the priority, because the work is a part of it, but you can't make that, your life. Yes, it is your career, but not your life. So like I'm here in my office at home. I say, this is great. I can, otherwise, it'd been better if I was at Cal State Fullerton, but at least when I'm done here, I can have lunch with my wife and I said, hey, just talk about, I had this great interview, on Zoom with Cal State Fullerton. So Brandon was this great guy, and got to know him, and it's a good thing. As I enjoy doing these things, and coming back to Cal State Fullerton, lecturing or giving talks, mentoring others, and and just that even keel, because yes, I still watch my sports. I like training, exercise, and do things I want to do, but just looking out to do things like my wife likes to, like to travel. I don't like to garden. But we go shopping, things like that. So
yeah, that's awesome. That's awesome. So also kind of switching gears a little bit. So in the world of pediatric care and pediatric medicine, what are some of the things that you see that need to be fixed in this program, I guess nowadays? There are socioeconomical disparities that are keeping patients from care. Are there certain practices that you see that wish were standardized more, or what is your opinion on those issues?
I think in the emergency department it's a little bit different, because we take all comers. We don't discriminate of what is the people's ability or inability to pay. But I can see where everyone should have access to healthcare, no matter what their economic level is, or able to pay, or able to have insurance. So I know we're in the middle of our election time, and this could be another 2 hours of me just ranting and raving about that. But I think it's just that I'm fortunate to work in a specialty where I don't have to worry about that as much. If they come in, they say, "Oh, we don't have insurance," I don't really care, really.
Yeah.
And I'm happy to say that, but I know that
it doesn't affect you, right?
Right.
Like,
I know like people need a specialty care. They need to have like, a gastroenterologist or a cardiologist or endocrinologist to take care of the diabetes. And I think that's a big problem. And I think that whether, with the new, whatever, administration that's in power or the government or higher ups, and it just wish there was equal access, which we supposedly should have. And I'm for that. I'm not saying who I'm voting for or what party I'm aligned with, but it's just one of those things I think that everyone should have access to care
and you get the first, you especially get the firsthand, experience, and you see, how that affects people and how, these different issues, that are going on, differential access to care. I've also read in different, statistics and stuff that minorities and stuff are disproportionately affected by certain diseases and stuff because either their access to care or discrimination in medicine in general. And so, I'm sure that you, definitely see these problems, as a, physician and stuff, and you're going through, seeing all this stuff. And so you probably have a much greater understanding of the actual issue than, everyone else does who, doesn't really see the behind the scenes stuff.
Right. Like, for example, African Americans are prone to having sickle cell disease. Our hospital is very charitable. They'll take whoever. They'll make arrangements. They'll make sure they get either Medi-Cal, California Children's Services, anything to help cover for them so they can have access to our hematology clinics, things like that. So, I'm fortunate to work in such a great organization that provides access for these people. And, we get a lot of things like, well, I see you have a certain disease, you should see a rheumatologist. Then maybe you should go back to your regular doctor. Well, I don't have a regular doctor. Well, we have a clinic here for general pediatrics. I'll give you the information. You can hook up that way.
That's awesome.
We give them the resources to get access to these subspecialties if they need it.
Yeah, and that's what all you really can do is give the resources that are available, and hope for the best and stuff. And so, I think that's a very admirable thing that you get to see all the really all the behind the scenes stuff that not a lot of people think about. I mean, when you go to the hospital, you're thinking about yourself and you're thinking about your own care, but you don't really think about people who are less fortunate, the type of care that they may be receiving. So that's a really interesting thing that I think people think about whenever they're going into medicine, because you shouldn't have to shop around for your care.
Yeah, a lot of people do that, and they like, we're the 5th hospital emergency department they come from. I said, well, why? What do the other people say? And I was telling my residents, the buck stops here. They're not going anywhere else. We try to figure out what their plan is. And like you said, a lot of people behind the scenes, social workers, registration people, they want to make it work for these families.
Yeah, absolutely. It looks like we're getting pretty close to time, but are there any last words that you have advice for the students, and just like advice that got you through your journey? Anything that you want to say?
I was, I just say that medicine is a wonderful profession. It's very fulfilling, and it's just been very good to me. And I've been in it for almost 30 years. I enjoy what I do. I live in Orange County, but I drive up to LA. I've been doing that for almost 30 years. I must like it to continue that, especially even with the high pressures of the emergency department. It's a great place to work. And just keep your mind focused on the goal, work hard, and do well. And anybody have any other questions? I'm sure that the Einstein folks or the health professions people can give out my information. I'd be more than happy to answer any questions they may have.
Absolutely. Thank you so much for meeting with us today. And I think that this is going to be very, very beneficial and helpful to all the students who watch this. So thank you so much. And, personally, thank you, because you answered some of my questions today too, that I was wondering, just as a, student who's interested in going into medicine. So I really appreciate, you taking the time out of your busy schedule to, talk with us today. And yeah, I hope that you have a good rest of your week. And thank you so much.
Thank you, Brandon. My pleasure. And hope to talk to you guys real soon.